My name is Lin Chu, and I have known Dr. Price for a long time, and I started knowing him when I went to listen to one of his speeches. He used to do speaking stuff at the Centerpoint, and I had some issues with my health, so I went to consult with him after that, and he helped me through that because I didn't want whatever I had to come back. And then a few years ago, I had 3 slip discs, and I was in really bad shape, back pain. I couldn't stand, I couldn't sit, I couldn't do anything for 6 months. And I came to see Dr. Price twice a week. He worked on me, worked on my back, my neck, everything. And he's just an amazing chiropractor as well as a healer. So he encompasses both techniques in the healing world, which is why he's so good. And that's the reason I've always admired what he does. And he is so different from any other chiropractor that I've been to. That's why I recommended a lot of my friends to come see him, because he's not just a chiropractor, but he's also a healer. He combines both techniques, so he's above all the other chiropractors that I've seen. So he's just the man. If you need any work done on your body, any healing, he is the guy to come to.
Hello, this is Dr. Patrick Price today, and I'm here today with Lin Chu. She's the patient today to demonstrate neck pain and stiffness. We're going to go through a couple range of motions just to show you where she is and show you how actually the neck can cause you shoulder problems, or let's say shoulder dysfunction. A lot of times we think it may be the shoulder or the elbow or the hand, but if you just trace the nerve up, you'll see it actually comes from the neck. That's the source. That's where the nerve root comes out of the spinal cord up here. So today we're going to take Lin Chu, and first of all, I like to do just some range of motions. I'm going to have her just lightly flex to one side. Notice her range where it is here. Go the other way. Okay. Go the other way one more time. Just you see where she's more limited on this side. Okay. Now she's going to turn and rotate one way. Good rotation. She's going to go the other way. And notice she don't go quite as far that way. Okay. Looking up to the roof, extension, and looking down. So you see, she's not stuck like someone who's had a massive trauma to the neck, so like an accident or a car wreck, things like that. But she does have limited range of motion, and she notices pain in her shoulders quite often. So when you look at the shoulders, you look at the big muscles first, the deltoids. Hold it strong and you resist. Okay. She points her hand down, and you see, boop, and there she loses power. Right. Now here is another area of the shoulder, testing the muscles here. And once again, I'm not going to give the details like a video would be for the doctors. I'm just going to let you know where things don't quite work. This is one that's weak in a lot of people. Didn't quite hold right there. And once again, the big deltoids looking here. As she points down, you'll see the rear deltoids, your little suitcase muscles, I call them. They get kind of weak sometimes. She's strong, resist here, strong here. We're going to have her lift up, and here she's really got power loss. So if you look up these muscles, these are called the infraspinatus. And you'll see that these don't work so well. If she resists, I push and I can still make them move. So once again, we're going to look and see that it comes from here. Now I could go to the muscle itself, but I'm going to look at the source of what's really going on. Now we looked at a range of motion, but what about how much strength she has? Put pressure here. Okay. But if she turns the angle of her neck, notice that she loses power. I can push her head right back up. Now I know she's been in a car wreck in the past from her history, but hold it strong, and you'll see even here she's lost the power. But one thing I want to tell you today that you've never heard of, at least most of you out there watching, is this could be from somewhere else. She's going to make a fist and she's going to touch her stomach. As she comes down, same angle that went weak, remember, hold it strong, she's got full power. So it tells me not only does she have stuff coming from her neck, she's got a nerve that's been pinched in her neck, but she also has some kind of stomach distress. We know from history that the flexors, extensors of the neck have the relationship to the stomach. But we're going to focus on the neck itself, but just remember there is a underlying stomach issue going on too. Other muscles that relate to this area are going to be other shoulder muscles. As she holds her hands together and locks the elbows, you'll see that she can't hold the contraction here at all. But once again, if she touches the stomach, hold it strong, she's got full power and strength. Okay? Very interesting, huh? Okay, so let's do this. We're going to let her go ahead and touch the stomach, and we're going to find out where the source is. I'm going to use another muscle to ask the body the question, and there it is right there. Notice she's strong, but when I find the spot, it shows that there's a short circuit in the neck. Let this go down, let this go there. So, hello, there we go. And her neck's quite stuck, so it tells me she's not been adjusted in a while. How long has it been since you've been adjusted?
I don't know.
Over a year, right?
Oh, for sure.
Okay, so it's been a while. Oop, there we go. So we get both sides. This is the C5 and the C6 area. I want to make sure it's good and loose again. Now, let's see if we made any change. A way to always find out is ask the body the questions, and the body's going to tell you, hold these strong. And she's got full strength back to her muscles again. If she touches her stomach, remember this before, made her strong, now it does just the opposite. So these are the ways to ask questions to the body directly. Now, let's check her here. Hold strength. Good, she's got strength again here. And she's got strength again here. How about that? Let's check her rotation now. Look one way. And go the other way. Good. Now let's go laterally to the side one way. Go one way. Good. Yeah, you see she got a lot more lateral flexion. Go the other way. Good. Much easier to go. But what about those other muscles? What about up here? Okay. Let's go up here. And if I push, resist. Okay. These still don't work, do they? So this tells me she's got one more thing going on. The thyroid is here, and the thymus gland is here. So we're going to have her touch where her thymus gland is. Hold this up, and we'll see that this relates to, once again, you've seen other videos of us talk about these little vascular spots on the head. You ever push on your head and find these little tender spots? Right down the cranial line here. It's just like, wow, those are really tender. They burn. Burn, right?
Yes. Yes.
This is something good to do every time you go to bed at night and you lay your head down. Get up here and feel on your head and find these little spots that are tender and they burn. These are little blood vessels that need to come back on, those little capillaries. Okay? So all we're doing is hitting some little spots on her where those capillaries are. Good. Now, let's see if that made a change. Resist. Full strength. Hold it strong. Full strength. So now she raises these up. She's got full strength as I torque and try to make that shoulder move. Her deltoids were okay, but we put them down. She had the rear deltoids. Hold it strong. Full strength now she has in her rear deltoids. So as you see, from the nerve to looking at the glandular function, the thymus gland and the stomach, we had to look a little deeper. And that's why they call me the body detective. Patients call me this because I look past the initial adjustment and look deeper in the body. I'm Dr. Price here today, or Lin Chu. Thank you for watching. You take care.